I'm very glad to take a part on the Congress. Thank you, Professor Ugo Caru, for your kind invitation and for the possibility to take a part online. My topic is craniomandibular dysfunctions and craniomandibular disorders. This is the same modern diagnostic methods. And today I want to present a little part from our work on this topic. The aim is to examine the uses of extraoral contactless thermodiagnostics as part of the diagnostic protocol for patients with temporomandibular disorders. Materials and methods. The present study is based on 68 patients.
Sorry, Mariana, we can't see your presentation. Please go in the next slide.
Just a second. Just a second. And now, can you see now the presentations?
Yeah, perfect. Okay, it's okay.
Maybe I shall left it so, on this way. Material and methods. The present study is based on 68 patients, age 42.9 years, divided into two groups. Main group, constituting 34 patients with TMD, and control group, constituting 34 patients. All patients had previously been subjected to a clinical functional analysis. Thermovisual diagnostics was carried out twice at an interval of 20 days in different projections: frontal projection, projection neck, projection left profile, right profile, projection left profile but patient turned to the right, and projection right profile, patient turned to the left. Projection nape. Images with the second color palette, we have also make evaluation of images. In the green range is normal. In yellow range, rich vascularized areas, normally warmer, and in the cold range, blue-black, normally cold areas. Positive thermographic findings are images with examination. Patients from the main group were subjected to relaxation therapy and pre-prosthetic preparation with aqualizer. TMD patients received additionally 8 treatment session massage, and after that 6 session ozone therapy. Results. In the control group, we found a high degree of thermal symmetry with the facial median line. For 88.2% of patients, thermographic images of the left and right side of the face appeared symmetric. The temperature differences are up to 0.4 degrees, below the threshold for pathology from GRAD and sickness. Here you can see the patients in this group, muscles temporalis and muscles digastrici. Also muscles sternocleidomastoidei. Thermographic findings in patients from the main group. In the first test was estimated high intensity thermal images, 91.4% in the area of left profile. Also on the right profile in 94.1% of patients. On the nape in 85.3% of patients. Here you can see the images of left and right profile with a second color palette. This is another clinical case, and it is visible the thermographic positive findings in different areas of muscles temporalis dextra, articulatio temporomandibularis dextra, muscle sternocleidomastoideus dextra, also in muscles temporalis sinistra and muscle digastricus sinistra. You can see also temperature difference between the two TMJs and temperature difference between the two muscles sternocleidomastoidei in this clinical case. This is another patient, also with areas with heat intensity in the left profile, also in the right profile. Quantitative characteristics of the test thermography are very good. For example, for the left TMJ were established 60% sensitivity, very good specificity, positive predictive value 75%, negative predictive value 72.7%, accuracy of the test is 73.5%. Patients who do not have finding in the joint at the first survey do not have in the second two. And thus, who had positive thermographic findings, they decreased significantly in number, area, and intensity. This is another case. Here, positive thermographic findings we have in muscles temporalis sinistra, muscles sternocleidomastoideus sinistra in the first thermography, but in the second thermography, we don't find positive findings in this clinical case. Positive thermographic findings in other muscles groups, you can see left and right at the second thermography, limited finding in muscles sternocleidomastoideus is also possible to see here, but in small areas. Result received show that in patients with adjacent TMJ, the temperature can increase from these degrees 0.66 to 1.41 degrees. This is 95% confidence interval. At envelopment of muscles temporalis, the temperature of the muscle will increase in these areas from 0.71 degrees up to 1.21 degrees, 95% confidence interval. On this slide, you can see the same information about different muscles, muscles sternocleidomastoidei, muscles digastrici, and masseteri. Applied McNemar test showed that the change between matching thermal images from the first and second thermography was statistically significant with regard to all structures investigated. The change in thermographic pictures of the both studies of all the patients with TMD are logical and are a result from the relaxation of the masticatory system. The method thermography provides documentary and diagnostic aid for patients with TMD. Completely painless and harmless is the method, non-side effect, without restriction on use, non-invasive, descriptive, very informative, quick, and relatively low cost. Thank you for your attention, and I will be very happy if you if for you was possible to see and to hear my presentation. Thank you again.
Thank you, Mariana, for your contribution.